everyone. Happy Asian Heritage Month. We are ready to dive deep into the wellness waves with AAPINA of Nevada, where we can talk about almost everything from physical, emotional, spiritual, and financial well-being. Our goal is to educate and empower the community. This is in collaboration with PHLV Radio, the only Filipino experience in Las Vegas, across the USA, in the Philippines, and in the world. I am Zarah Borines, a registered nurse and educator and assistant professor at Nevada State University, and one of the Caritas coaches and leaders trained by Watson's Caring Science Institute. I am the immediate past president of AAPINA of Nevada. I am grateful today since I have my co-host, Dr. Andrew Reyes, the current president of AAPINA of Nevada. Sir Andrew, can you introduce yourself?
Thank you, Zarah. My name is Andrew Reyes. I am the president of the Asian American Pacific Islander Nurses Association, or AAPINA of Nevada, a chapter of Nevada of the AAPINA National. And so I am also an associate professor at the University of Nevada, Las Vegas. Thank you very much, Zarah.
Wow, thank you so much, Dr. Reyes. And we would like to congratulate Dr. Reyes. He was one of the awardees during the Tanglao sponsored by PNA-NV. Congratulations. We are blessed today to have Dr. Ludy Llasus to be one of our guests in this episode. Wellness Waves of AAPINA of Nevada embraces the caring science by Dr. Jean Watson, right? So Dr. Llasus is a tenured associate professor at Nevada State University and a national board certified family nurse practitioner. Dr. Llasus is an excellent nurse educator, an effective academic leader in nursing education, and actively practicing as family nurse practitioner in Southern Nevada. Additionally, Dr. Llasus, a caring science scholar from Watson's Caring Science Institute. She is also one of the Caritas coaches and a leader working closely with Dr. Jean Watson, a major nursing theorist in advancing caring science in nursing education curriculums. So Dr. Llasus plays an instrumental role in translating and living out the theory and philosophy of human caring healing in the service of transforming nursing education and nursing practice. Congratulations, Dr. Llasus, and welcome to our episode today.
Thank you so much, Dr. Borines, for having me here and giving me an opportunity to educate the public about caring science and its role in our nursing education.
Yes, that is great. You are here today with a mission of educating us and also the community. So maybe we'll proceed now. Dr. Andrew Reyes, can you give them the first question for the day?
Yes, thank you, Dr. Borines. So, Dr. Llasus, through the Gallup poll, we have, for many years, nurses have been surveyed as the one of the most trusted, number one on the list of the most trusted profession in many countries, particularly here in the United States. And I think it's because of the core concept of our profession is caring. So tell me more about what is caring, and especially in the based on the perspectives of one of the nursing theorists in our profession, Dr. Jean Watson. So what is caring science theory by Dr. Jean Watson? And can you just educate us and the community about it?
So caring science is a philosophy of clinical practice model. It is rooted in the deep essence of nursing, which is caring. And it is a foundation. It is a disciplinary foundation and core of professional nursing.
Mm-hmm.
And it also is technically and essentially a philosophy for a clinical practice model.
Thank you, Dr. Llasus.
And that is true. And I'm also one of those caring science coaches. And basically, we really apply this caring science in every day of our lives. So Dr. Llasus and I work together, and we really have to work harder so we could implement this caring science. So thank you so much, Dr. Llasus. So I would like to ask you, what is the essence of caring science when it comes to being a nurse. So how can we promote the importance of Caritas literacy to the community?
So when you say Caritas literacy, right? Literacy is basically a term we describe competency, which is the technical term. So it means to be competent and fluent in the learned skills of heart-centered intelligence, knowledge, and skillful ways of being a human. So not just being a human, but elevating it to the being and becoming of a nurse. So in that essence, it is the embodied knowledge of living out and practicing caring within the context of our nursing practice. That's why it is called the core and professional foundation of nursing practice. So that is, in essence, how a Caritas literate nurse is practicing. It is guided by the language of how to practice caring as a human being, as a caring and compassionate nurse.
What can you say, Dr. Andrew Reyes? Is there anything else you need to add for those?
And how is this, how do we see this in practice? Like, caring. And, if I am a nurse in a hospital or in a clinical practice setting, how does it look like?
So a caring informer, what we call a Caritas informed nurse, or they start first as a student nurse and subsequently become a practicing nurse, practices and guides their clinical practice with the 10 Caritas processes. And that starts with caring for the self, having loving kindness to self and others, being authentically present, recognizing the need of every human being for dignity, that human to human connection, and in ways to create that caring and healing environment. So our nurse, that a Caritas nurse or a Caritas informed nurse, practices the deep philosophy of caring. So that's how it looks like. It empowers the patient to heal because of that deep connection, that human to human connection that the nurse provides. And most of the nurses already do this, but they do not have that language. So when they are oriented to the Caritas literacy, and this is so important to have the nursing education, part of the training is to educate the nurses on how to sustain their caring being. And that is to recognize how do we care for others. It is not to be assumed, but we have to intentionally educate our nurses so that they are caring for themselves. Because nursing and caring for others is simultaneously very rewarding, but also depleting. And that is why there is that burnout that is happening. And so we have to teach them how to care for themselves and sustain and water their caring being for improving patient outcomes.
And that's really necessary, Dr. Llasus, because basically what we've been taught before is more of self-sacrificing, right, Dr. Andrew Reyes? It's more of, okay, you do everything for your patients, but not thinking of ourselves. We're also like human beings. We're the same as our patients. Just so happen that we are well compared to them. So what I'm getting from Dr. Llasus' explanation is that we have to take care of ourselves as well. That would be the basic things, because if you cannot take care of yourself, how can you take care of other people? Right?
That's correct. Thank you, Dr. Borines. And what I'm also hearing, Dr. Llasus, is that it all, learning about caring starts at school, right? And I think learning about caring is even more important than learning about the technicalities of being a nurse, like, the pathophysiology, how do we care for a patient who has a lot of those equipments and all those, intravenous and all those medications. So on top of learning the technology associated with nursing, really the core of it is really to learn more about what caring is, and it starts
Yeah.
first with self-care. And it starts at school, like you said, and we are here all educators. So I guess my next question, Dr. Llasus, is more about learning about caring, especially the philosophy of caring, as in the perspective of Dr. Jean Watson, who is a nursing theorist. And why is caring science theory implemented in some schools but not in other schools? Isn't it really a part of the nursing curriculum? Because it's really the core of our profession, caring. And so why is it that we don't see that in other schools being implemented as part of their curriculum?
Great question. Each school of nursing, I just want to let the community know that each school of nursing has its own distinct philosophy that outlines their educational practices, their research activities, and their services to the community. So, in a nutshell, the philosophy of a school of nursing reflects the school of nursing's approach to nursing education. It just so happened that at Nevada State University, we are very intentional in embracing caring science to guide the education of our nursing students. And this means that we are embracing the art and the science of nursing. We focus on the skillful competency of our students without sacrificing their being and becoming of being a nurse. So their attention of how to become and their being of a nurse is focused with the caring science. So caring science is a foundational disciplinary knowledge of the nursing discipline. There are multiple caring and theories that is unique to nursing, but we just so happen that we embrace that. So each school will have their own philosophy of nursing, and there is that proposal to use caring science by the caring science experts to use it as a framework in implementing the essentials of baccalaureate nursing education.
Now I understand it better. So each school has their own theoretical, that they have to follow through, correct? And it so happened that in our school, it's Dr. Jean Watson.
Yes,
right?
So it is the school's approach to nursing education. How do they educate their nursing students to be professional nurses and ready to work in the workforce for wherever their school is?
All right. Thank you so much. That's really a good point there, Dr. Andrew Reyes. What about you? Do you know who is your theorist in UNLV?
So I'm also an associate professor and educator at the University of Nevada, Las Vegas. We don't really have a particular nursing theory that we embrace. And so it's really good for the Nevada State University that you embrace a particular nursing theory, which is the caring science theory by Dr. Jean Watson. And what do you think is the advantage when you really have a particular nursing theory? Embracing, the students can embrace.
So the advantage is preparing nurses who are practicing guided by the disciplinary knowledge and theory of nursing. It's like, as everybody says, caring is nursing, right? So we do not invent caring, but rather we articulate what we do and how we do it and how we demonstrate it in our care. So caring science and educating our students within the Caritas literacy and the caring science framework gives them a language of how and articulating exactly what caring is and how does that look like when it is being implemented in the caring science and in the caring of patients, and not just of our patients, but also to self and others, because the Caritas literacy applies both to personal and professional being of the individual.
Wow, that's a good one. But before we proceed, I would like to pause because we will have something like a news. So I would like to invite everybody else out there that I would inform you that Nevada State University is offering now our master's degree, which is an emphasis with leadership. So this degree would be going into like 12 months, and it would be starting this coming fall of 2025. So please contact Dr. Michelle Odie with the contact email address is michelle.od@nevadastate.edu. For those who are just joining us, we would like to get you a heads up that we are talking here at Wellness Waves about Caring Science Theory by Dr. Jean Watson. And in this episode, we are also like influencing our nurses and nurses to be, right? And we are here with Dr. Llasus as our expert. All right, let's proceed. I think the next question, Dr. Llasus, is what it is, how does the process look like if you want to be a Caritas coach or a Caritas leader?
Okay, so a Caritas coach and a Caritas leader are individuals who have been primarily educated through the Watson Caring Science Institute coach education program or leadership program. So both of these two roles demonstrates a deep understanding of the human caring, transpersonal care, reflective practice, and embodying caring and the Caritas literacy. So they can apply, and it is a special program. The CCEP, or the Caritas Coach Education Program, is a 6-month program offered by, like I said, the Watson Caring Science Institute. It requires an application process. It's a application fee with tuition payment, and it is offered in November and in May. And to become a Caritas leader, which you essentially mentioned earlier, right, to educate our community about nursing leaders, which is so badly needed in our profession. So a Caritas leader is an individual who embodies and applies the principles of caring science, and one who is able to apply the Caritas processes and the theory of human caring to create a culture of authentic caring within their organization, and to value the caring values and where it is practiced within their organization. And this is very important because one of the Institutes for Healthcare Improvement quadruple aim added that fourth focus, which is to improve the well-being of healthcare providers. And so at Nevada State, we look at, in the caring science, we look at the Caritas processes and the science as a framework to improve the well-being of the nurse leaders and subsequently the nurses, and subsequently creating that healthy work environments. So they can also become a Caritas leader through the Watson Caring Science Institute, and this requires a commitment. This is usually a 6-month long program with a 4-hour commitment, monthly commitment to be educated into the courses to deeply, to deeply understand the human caring and the caring science and how to implement it for the purposes, again, of creating that caring, healing environment where all of the nurses thrives and not just merely survive, but thrives and avoid burnout and enjoy their work and actually loves to go to work. And again, those, according to the Institute of Healthcare Improvement, if there is well rested, well cared for healthcare practitioners, this can affect patient outcome, caring costs, among other things that they have mentioned in the quadruple A.
So then, can we also recruit nurse leaders from the clinical setting? It's not only in the academic. Is that possible?
Absolutely. So, again, caring science is a philosophy of clinical practice model. So I would like to mention several institutions that have embraced the caring science. So we have Stanford
Yes, there you go.
Hospital. We have the Kaiser, a lot of Kaiser hospitals in Northern California. In the East Coast, we have University of Miami, Queen's
Wow.
Health. There are so many clinical practice sites, again, because this is a philosophy of clinical practice model, and that works on creating that caring, healthy environment, and which again is the goal at the moment, because a healthy work environment supports our healthcare providers to prevent burnout and increases outcome, and especially what our goal is here, which is positive patient outcome and healing our patients.
That is really great. Thank you for this enlightenment, Dr. Llasus. Is there any additional questions?
Dr. Llasus, is there a difference between a Caritas coach and a Caritas leader, or are they just the same thing?
So a Caritas, philosophically wise, they are both there to integrate. They have a deep understanding of the caring science, and they are there to integrate caring science into their organization. The difference is that as a Caritas leader, it is functioning at a higher level of organization to really work in creating that culture of caring and excellent working environment that is really rooted in understanding the being human, the deep human to human connection within their organization. And so it works and facilitates the creation of healthy work environments because of that. So that the Caritas leader is a leader within the organization. The Caritas coach can help individuals within that organization to start working on understanding the deep knowledge of caring science, and through the Caritas processes, which is the framework of the caring science within the context of Dr. Jean Watson's theory.
Yep, and that is awesome. Did you know that Dr. Llasus is both? She is a nurse, Caritas coach, and at the same time a Caritas leader. So we are having a good time here, but we are almost done with our time. Dr. Llasus, is there any parting words to our audience at this time?
Yes, so I encourage all nurses. It is a call to action to our professional nurses to have that intentionality to practice and really highlight caring in your own practice. And that starts with self so that you don't burn out. So you are actually functioning with a full cup and ready to provide that best experience for your patients.
Wow, that is nice. Any parting words, Dr. Reyes?
Yeah, thank you very much, Dr. Llasus. There's always this metaphor about human being. We always think about, we think that we are just human doings. Like, we always, in nursing, I think we focus so much on the skills, and that is really good too. We are knowledge workers. We need to learn the skills. We need to be skilled nurses. But I think the core of it all, especially if we don't want to be burnout nurses, right? I think we need to really, focus more on our beingness, our human being, and the very being that we are as nurses is really focused on the phenomenon of caring.
There you go. He got it so well.
And the caring science is the framework for developing and cultivating our being in addition to our doing, because we cannot separate both the caring, because the science and the art of nursing goes together.
Very good. I just love it. All right, to our viewers, this will be our takeaway for today, that caring science is essential in our nursing profession. We all know that caring is the essence of becoming a nurse. Just like what Dr. Llasus explained, caring is look like a core and a trim. The core is the caring, while the trim are the knowledge, skills, and attitude. goes hand in hand. They should both go in hand together to be an effective nurse, right? And Caritas number 1, because we mentioned about the Caritas processes, Caritas number 1 to 10 is the framework of the caring science. And we just have to make sure that you will not forget about Caritas number 1, which says loving kindness and equanimity with self and others is very crucial in our practice. Self-care is needed to prevent burnout, promote job satisfaction, and promote patient satisfaction. Thank you, PHLV, for this privilege of educating the public. Thank you, Dr. Llasus, for the expertise. And of course, thank you, Dr. Reyes, for the time. And in behalf of Wellness Waves of AAPINA-NV, this is Dr. Borines signing out for everyone. Thank you.